There is periarticular soft tissue swelling localized medially and laterally to the tarsocrural joint, and it is much more extensive medially compared with laterally. And it's somewhat longitudinal in its orientation, following the course of the superficial collateral ligaments. The lameness has improved somewhat to now being only 4 out of 8. Hock flexion was negative, as was radiographic examination. Ultrasonographic evaluation revealed that both the superficial and the deep collateral ligaments of the tarsocrural joint were injured, particularly distally, as we see in the image second from the right, where we can see marked disruption of both the superficial and the deep collateral ligaments. There is echogenic material within the lateral plantar pouch of the tarsocrural joint, which is an organizing hematoma. Peritarsal cellulitis results in an acute onset severe lameness and reluctance to bear weight. At the very acute stage, there may be no soft tissue swelling, but in the ensuing hours, there is rapid development of peritarsal soft tissue swelling, which is usually, but not invariably, maximal dorsomedially. There will be severe focal pain with light pressure, what we call allodynia. The horse may be pyrexic, and ultrasonographically we will see subcutaneously this almost anechoic area with some small echoes within it, typical of acute cellulitis. This must be treated aggressively with broad-spectrum antimicrobial drugs. In this horse, we can see firm swelling on the distal medial aspect of the hock. This was related to periarticular new bone formation associated with advanced osteoarthritis of the tarsometatarsal joint, almost invariably of clinical significance. In this horse, we see a longitudinal swelling on the dorsolateral aspect of the hock. The swelling is interrupted where the large yellow arrow is by a retinacular band which compresses fluid within the long digital extensor sheath. We can see comparative images of the right and left hind long digital extensor tendons and their associated sheaths. The right hind long digital extensor tendon is substantially enlarged and has areas of reduced echogenicity, and there is an abnormal amount of fluid within the tendon sheath. A so-called capped hock appearance can be due to a number of different causes. There may be distension of the calcaneal and/or gastrocnemius bursa. It can be incidental in some horses, but if there is associated lameness, the primary differential diagnoses include gastrocnemius tendinitis. We see ultrasonographic evidence of this to the right. The gastrocnemius tendon has a very irregular lateral border and is of heterogeneous echogenicity. Other causes include luxation or subluxation of the superficial digital flexor tendon from the point of the hock, which will be the result of tearing of the calcaneal attachment of the superficial digital flexor tendon. There may be primary synovitis, or there may be infectious a problem, and if we suspect infection, we must always look for a wound.